Hi, I'm Dr. Joseph Kim, a medical oncologist at Yale Cancer Center and an associate professor of medicine at Yale University. This year's ASCO was again filled with several exciting presentations. In bladder and kidney cancers, one of the overarching theme was that there's an emerging role of immuno-oncology in treatment of kidney and bladder cancer. And in muscle-invasive bladder cancer, several immune checkpoint inhibitors are being investigated in combination with the cytotoxic chemotherapy to improve the efficacy of systemic treatment as a bladder intake cure for a muscle-invasive bladder cancer. The study led by Dr. Gelsky et al. Showed that gemcitabine cisplatin plus nivolumab showed nearly 50% clinical complete response rate in patients with muscle-invasive bladder cancer. Most of these patients were able to preserve their bladder following complete response. We do, however, need to wait for long-term follow-up data to understand the benefit of this chemo-IO combination as a bladder-sparing treatment. In metastatic urothelial carcinoma, we know that avelumab improves overall survival as a first-line maintenance therapy after platinum-based chemotherapy. Dr. Powell's reported updated data from Javelin Bladder 100 showing that the benefit of this treatment does not seem to be limited to certain clinical or genomic subgroups. And in kidney cancer, adjuvant pembrolizumab post-nephrectomy demonstrated an improvement in disease-free survival versus placebo with a hazard ratio of 0.68. This is very encouraging. This is the first positive trial in adjuvant therapy for renal cell carcinoma. And this has a very high impact, high potential of becoming a new standard of care for renal cell carcinoma. And in metastatic renal cell carcinoma, pembrolizumab and axitinib continue to demonstrate clinical benefit compared with the sunitinib as a first-line therapy with improved efficacy in overall survival, progression-free survival, duration of response, and complete response rate. Again, I want to thank ASCO Direct team from Total Health Conferencing for this opportunity to speak to you on ASCO highlights in GU malignancies. Thank you.